There have been major changes. When I went to dental school, I graduated dental school in 1983. So at that time, if I compare dentistry in '83 to dentistry today to what we're able to do, it's a totally different world. That being said, some dentists are still practicing as if it was 1980 in the 1980s and 1990s. The equipment's the same and the techniques are the same. So it's important when a patient comes into the office, I think if you go into an office where everything looks old and seedy and dusty and not up to date, that fear factor is elevated. So for me, a big part of it is to have equipment that's brand new, that's up to date, not only new, but technologically new and advanced. It gives a sense to start with for the patient, well, okay, maybe I'm in the right place because I feel a little comfortable with the types of things that I'm seeing here. This isn't my father's dentist. This isn't the dentistry that I went to as a child. The manner in which you're treated in the office, the way that you're spoken to, acknowledged by name, that you're cared for and concerned, that care and concern is shown for you by the front desk staff, even on the telephone, in accommodating you and accommodating your needs. If you ask for, if it seems like your neck is hurting, to give you a pillow, those types of things will make you feel, okay, maybe I can get over this innate fear. That being said, it's a difficult road, when the dentist has to acknowledge that. When I know a patient is fearful, and I can put my hand on their shoulder and say, listen, I understand where you're at. I understand, and I need you to let me know exactly how you want me to approach you, how you want me to deal with you. I can explain everything to you. We can go as far as pre-medicate you if you need. I can give you medicine to help you feel more relaxed when you come in. I'd prefer not to do that, but if you need that, we can do that. We have things that we can do, such as sweet air, which makes you feel a little happy and out of yourself a little bit, even though you're in full control of everything. So it calms you down, so we can do things like that. I can not show you instruments. I can tell you or not tell you. Some people want me to talk the whole time. Some people want me to shut up the whole time. I'll do either way. So there are manners that deal with it. They're giving you control. When you have a sense of control as to what's going on, if I say, you know what, I will get you completely numb, and I won't do anything, but if you feel anything, I need you to let me know. I'm so in tune with you that if you open your eyes just a little wider, I will know that you need me to stop. If you want to raise your hand, Donna is willing to hold your hand, my assistant, or Jessica, they often will hold a patient's hand, and the patient right away knows it, and they put their hand out to be held. That's all it takes, and so there's a levels of care. We can, at the worst end of the spectrum, or the most severe end of the spectrum of fear, we can actually have patients sedated and put them to sleep. There's some patients, very few, but some need to do that for cleaning. So there's a wide spectrum, but usually the majority of patients, I'd say 90% of patients, it's just the manner in which they're treated and the sense of comfort that they have in the office that gets them through everything. And then the other end of the spectrum is children that come in today. They love coming.